You're focused and on what you believe in, how to achieve all your dreams. Keep moving forward.
The Hit Back with Nahaja Black is sponsored by the Cancer Treatment Centers of America, BTC, J.S. Johnson, Bahar Retreat and Spa, and Boost Academy.
It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black.
Good afternoon, Bahamas, and welcome to the Hit Back. I'm your host, Nahaja Black. It is a beautiful day in the 242. I hope that you are doing well, taking care of yourself, and living your best life today. Every day, I believe, is a great day. That doesn't mean that circumstances aren't tough. It doesn't mean that things that you left in yesterday didn't roll over in today. It just means that today is just a day of optimism, right? A day of hope, a day where things can go well. And sometimes your plans for that day don't work out that well. Your plans for that day, life throws you blows, you know? And this morning, I got some very sad news this morning. Some very sad news this morning where I'm still reeling from the news. And it's one where it really hit me deep. And so, of course, you all know that our beloved Dr. Lockhart has been in the hospital with COVID-19. And but building up, doing well. Well, early this morning, she told me that her husband, Laverne, passed away from COVID-19 this morning. So Doc is now a widow. She's now a widow. And it's tough for me. And I can only imagine how tough it is for her children. This morning, though, I was informed that it wasn't just Doc who was a widow. That there's a couple who's been married for years, and the husband passed away and the wife is struggling, right? And these stories continue. These stories continue all across the country. But of course, when and to know Dr. Williams Lockhart's husband is to know that those two were inseparable. Right hand, left hand, right foot, left foot, they were together. Every call that she went to, there would be Laverne with her on that call. If the call went until 1 a.m, there was her husband. Everywhere she went, there he was. And so, for me, I'm grieving as well. He was just a wonderful person. So COVID is real. And I tell you, when Doc came and sat with my mother and was helping her through, there was Laverne sitting in the car. There he was. Doc would say, Laverne, I need you to go. Vern, I need you to go and get X, Y, and Z from the pharmacy. And he would go. So Doc, sending prayer and tons of love. And the reality of this virus, y'all, the reality of the state of our affairs in this country is that people are dying. People are dying. We're losing people at an alarming rate due to COVID-19. Folks are not going to the hospital, or they're waiting too late, too long. One of the things that Doc shared with me this morning in her grief was that, Ms. Black, I helped to keep 17 people out of critical, and I couldn't do it with my husband. So, frontline, pay the doctors, pay the nurses. This isn't about money, but at the same time, appreciate the fact that they are putting their family, their loved ones in jeopardy to save ours, to save my mother, to save your mother. they're putting their family in jeopardy. And we have to. I mean, I think about it. It could have been my mom not here with us, but Doc was there by her bedside, and Laverne, her husband, was there the entire time. And so, the whole family is grieving, obviously. And so we send out prayer. We send out tons of love, but none of that replaces the people we lose. And it goes back to the story of who's expendable. Who can we afford to lose? I tell you, there's no way I'm good with losing my 75-year-old mother. There's no way. I'm not going to tell you that I'm ready to say, well, she lived a wonderfully full life. There's no way that's an option or a trade-off for me. Every moment is a moment. For the Lockhart family, it was too soon and too sudden. We're praying for Doc as she's trying to recover from this ailment herself, and that she gets home, but that this is a long journey. And this is the reality. The reality is that we can't think that it is someone else's problem. It is all of our problems. The frustration is, I don't believe we had to get to this point. The frustration for me is that, more should be happening. I asked a close friend of mine who works in healthcare, and someone who has the ability to get things done, and understand what do we need? Because Doc was in PMH, or Doc is in doctors, and her husband was at PMH. What can we do to help the folks at PMH? What do we need? And they say, well, we need money, equipment, staff. And I looked at all of those things and I said, well, we should have the money. We borrowed $250 million from the IMF, and only a small portion of it went to COVID. The majority went to state-owned enterprises. We said we expanded, but marginally expanded. We've got 5 tents, only 4 operable, but each tent is low on the necessary life-saving equipment. Folks are afraid to go to clinics, the ones that are remaining open, for fear of contracting COVID-19. We're not doing enough with the supplies and the staffing. We're playing around when the staff is marching in a pandemic, when the staff is crying out saying, but you're not taking care of us, you're not listening to us. And we're the ones on the ground telling you, do not let people come in. And this is where my frustration lies, because, people want to call it politics, but I call it people. You do policies for people. People, the citizenry, shouldn't. I had someone message me, well, Nahaja, you seem like you're interested in people. We need to do a drive. We need folks to donate X, Y, and Z. And you know what frustrated me with that request? Who, from what, and from where will Bahamians, the everyday Bahamian, the middle class is being squeezed into poverty. The poor can't get no poorer than poor. But there's a select group that keeps getting richer. And then they're having their, I don't know what to call them, asking us to donate from where, with what, how. You know what I need to see right now? I need to see all of those persons who are at the forefront of orchestrating feeding us, right? Who are at the forefront of managing, standing on the line, making sure that vaccinations go out, and being brutal, words used like brutal with our protocols. I need to see them spend some of their millions and get us some ventilators. I need to see them spend some of their millions from behind Albany, from behind Old Fort Bay, from behind Lightfoot Key. Show me you care about the Black child that's in Baintown. Don't just push vaccines. Push the equipment that is needed to save lives at PMH. Don't just let us die and squalor because there are not enough beds. Well, they ain't gonna tell you Samaritan Purse came here because of a good bishop, a Black bishop here in country, who connected this administration with Samaritan's Purse. So what are we doing? Where is the effort? Where is the support from those who have? I was told, well, those who have, they want to help, they want to help. They don't mind helping with testing. They don't mind helping with equipment, and they don't mind helping to define protocols. Hold on. Now we need to define protocols. The protocol should be left not for the Bill Gates type. Protocol should be left for the healthcare system, right? Okay, well, they want to make sure that businesses are taken care of. Yeah, I know, I understand that, and we can find it, and that's fair. But that doesn't negate being able to give of yourself and your resources. You don't mind talking in the press, but we're not seeing you put your money where your mouth is. You know how many Bahamians, and you talk about brothers keepers, Bahamians every day are making sure their neighbor has soup and bread. Bahamians every day are going into their pockets. Man, I can tell you, families are coming together. When they find out someone is in the hospital, what can I do? What do you need? Families are coming together. That hasn't been an issue for us. We are a brother's keeper. The challenge that will be befalling us, of course, the exciting news, the good news is we got more vaccines. But right now, a lot of people still won't take it. We're going to get a lot more. And this is good on the government's behalf to do this so that those who want to get vaccinated will get vaccinated. And I have to give kudos for the administration for that, getting them when you need them and getting them these large numbers. But at this point, ladies and gentlemen, at the same time, what we need is to spend more in healthcare. Spend more in healthcare. That's what we need. And if we don't have it, now it's time for the prime minister to have some large kahunas and say, we need some of our wealthy patrons in country to support us and come up with real numbers. We need 25 more ventilators, or we need XYZ amount of high flow oxygen. We need this amount of beds. We need this sort of space for quarantine. This is what you asked for. And you put it on them, put the pressure on them. Either they're going to show up for us because they show up for turtles. They show up for sharks. But they ain't going to show up for the little boy who gets shot at 11 down through the corner. They won't show up for the shootings in Elizabeth Estates. But they'll be fine giving them the right to feed the poor. What foolishness is this? And talk about compassion. People are dying now. People died this morning, died yesterday, will die tomorrow. And in PMH, there's not enough. Nurses and doctors, their loved ones are at risk, and you're playing with paying people. But you can stand up in the House of Assembly after taking a hiatus in the middle of a third wave and act like you're doing something. Little late, but anyway, better late than never. We'll take your vaccines. We'll take your vaccines. We'll take the Pfizer. We'll take the Johnson & Johnson. And for those who wish to take it, please take it. For those who don't wish to take it, please consider your neighbors. Please don't go around with the whole, it's my right to do anything you want to do. Be safe. Protect yourself. Protect yourself. Go ahead, take your vitamins. You can't eat fast food this period. You can't be stuck on fast food this period. This is where we got to show up for each other for true. Where is the chicken farmer? We got to start boosting local farmers right now so that we can get organic chicken. Put some money in there so we can eat organic. You know the audacity of it is. Some places, food stores ain't get a loss yet, have not had a loss, but they can tell us price is going up. A lot of these business owners are living high off the hog in COVID. They're not taking a cut. Oh, you know what? But everybody needs to get vaccinated or lose your job. My frustration in this period is I'm no longer, listen, we're going to have to get out of this. But whilst we're getting out of this, how many people are going to have to die? Because we're failing to lead in critical areas. All of that long speech, 34 pages by the Minister of Health, finally gave us numbers and data. But you know what it didn't come and boil down to for me? Okay. But what are the other strategies? What is the mass testing? Where is the quarantining? Who's going to supply the equipment that we're losing and we don't have? Yes, everywhere else in the world is going through their challenges. But you know what the benefit of us being an island nation? We can see it coming like we saw it the first time, like we saw it the second time, like we saw it the third time. Ladies and gentlemen, in February, Dr. Lockhart and her husband were saying to me, Nahaja, I don't know what they're seeing and saying, but I could tell you there are clusters. It hadn't spiked yet. We hadn't seen this Delta variant yet. This is different. You can tell something is different about the explosive nature of COVID-19 in country. It has to be a different strain. It is behaving differently. It is far more contagious. Far more people are falling over. This is taking people quickly, younger, children in intensive care or children in hospital, not intensive care. I can't confirm that, but in hospital. This is an issue that we have. But this was something that was seen and spoken of from February. Now Doc is a widow while she is still in the hospital. I got my friend, C.A. Nuri, joining me. Sorry, now I'm getting emotional. Let me call my friend on. What's up, buddy?
First, I'd like to extend condolences to Dr. Lockhart. I know she's a friend of yours. I know how close you are to her. I know that you depend on her. She's a confidant to you. And I know that today was a challenging day for you to come and perform your duties and to do what you do best with that in the back of your mind. So I just wanted to say that out, that my hearts and prayers with Doc. I appreciate what she's doing for the Bahamas. I see the sacrifice that she has made, and I consider this too as a sacrifice, and that we as Bahamians must remember what these people are doing on the front line on our behalf, and to remember to be grateful.
Yeah, and that's it. Just, man, listen, everyone, we have a part to play. I think that's important too. We all have a part to play. Try your best. And you know, one of the things that we have to be honest with, C.A. Nuri joining me, it's hard to social distance when you only got limited space. Yes. You can't quarantine when there's one bathroom, right? We share in a bathroom and all of us in this space. You can't necessarily quarantine when you're a single parent with 2 or 3 children. You have to take care of them. Who's going to take care of your 3 kids? Where do you go? So what it makes for in this situation is something that is difficult to contain. Something that is difficult with COVID-19 to fix if there's no space to put people, if there's no space for folks to rest their head and say, oh, I can tend to me while someone is watching my kids. I actually thought, when we first went and bought 23 new cars for this COVID task force, spending money we didn't have, that the COVID task force would not just be police with a different car, right? But I actually thought this was going to be a vehicle or vehicles where when people had to stay home, they would provide services like delivering grocery as we go to check up on you, right? That it would be a service or different services where we would, check to see if people are quarantining, right? And at the same time, what do you need? How do we ensure that you're in your space? Things that will work out to help us to manage and navigate and deal with this process. But today, what we need is equipment. I mean, it's a hard day today.
And it definitely is. And I heard your cry in terms for equipment and question, where is Life Key? Where is Albany? And we've been crying that for, beforehand. We know that a constituency like Albany has billions of dollars within there. Their residents have billions of dollars, where one resident there can worth $1-2 billion for one person, and they have a couple hundreds of them there. So the money is there. We know that they enjoy the Bahamas and they love the Bahamians. They came here for a reason, but they are indeed living in a gated community, and they have erected high walls and believe that the walls protect them from the nuances of what has happened inside the inner city and around the Bahamas. But I'm not angry at that or vexed at that. I understand. I understand that. But it should be incumbent of Bahamians, incumbent of our leaders to petition and to act that since you are living here, since you're enjoying the Bahamas, since you want the Bahamas to be a particular paradise, can you assist with that? And I find that Life Key is a generous subdivision. They tend to like to give. They might not know what to give toward, and we might need to have a middleman to say, well, this is a needed project that you assist in. And I find that if the hospital has no beds and that we need the heavy equipment beds or the heavy equipment machines, you ask them, this is what we need. In fact, I heard that your company that you own manufactures the machine itself, that you can get them dime a dozen and donate. We must take it upon ourselves to use that opportunity. And I actually say, man, since your brother-in-law owns the particular machine, can we have two?
Yeah.
And continue to ask, continue to partner, to be good citizen. And if we need to name a wing of the hospital after them, we'll name a wing. Say,
but
this
they
is your
gotta
wing.
show. See, listen, you hitting the nail on the head, right? Because my thing is it because, and I asked, Cecil, today was that day for me because I've been trying to figure out if Dr. Lockhart from in her room is still trying to help people.
Yes.
But she said to me, but I can't help my husband. She said to me, I couldn't help my husband. And when she spoke to me earlier this week, I don't even know what today is anymore. What's today? Wednesday. I don't know when we spoke. And then, one of the things that she shared was, I have this at doctors. There are tents and there are 10 people to a tent and only one machine to share between 10 people. That's unprecedented. That's unprecedented. That is unheard of. How do we, and then Cecil, to get a call or message from folks who I know get asked their rich friends, we need X, Y, and Z. Can you ask the Bahamian public? No, I'm not going to ask the Bahamian public who barely can go to the food store, done getting taxed out of their wazoo. We didn't get taxed out of it. You got $1 and 12% is already gone. The food store man didn't tell you he's going to increase the cost. But I got to ask my black brother, my poor brothers and sisters, not just black, because I got my Long Island Red who's struggling. I got my Abaconians who's struggling. Bahamians struggling. But we got folks who want to lead the food initiative and don't mind handing out stuff. You got Brent Simonet patrolling the vaccine hive. How much money has come out of that stead? And you said, Nahaja, why you call it? Because somebody got to call it. Somebody got to say, at least show your benevolence with a couple dollars. You wore Morgan's bluff. Jesus, come show up and give us $1 million towards getting these things done. I'm sorry, I ain't there today. Today ain't no time for us to sugarcoat. It ain't no time to sugarcoat, Cecil.
And I know you're hurting, Nahaja, and this is why I shan't critique you as much, because it is some strenuous things you're going through. But I know for the fact that the names you've called continuously donate to the Bahamas, right? They have
no. I don't mind. Listen, continuously donate, but you know what you need to do now? You know what you need to do now?
Go ahead.
Now, this ain't the okay. One of the things I could say about Mr.
Breed, my friend, breed.
When I spoke with him years ago, you know what he said to me, which I thought was very powerful and true. You know what he said to me, Nahaja, of all of the SANS, what he said, not SANS, Simonet children or the UBB children, I'm the only one who's really stayed and invested in the country. Very true. I could live with that. Businesses galore, making a lot of employment in country. But you know what it also represents, what Mr. Simonet, along with other persons, also represent? The higher, more affluent class of this country. The affluent class of this country who doesn't just have money, but who has access. You know what this administration has done? You know what this administration has done? Has proven itself very much to have the air of that particular constituency. Round here, want Bahamian people to be our brothers and sisters. Fine, let's do it. Let's do it. I could be my brother's keeper today. And today this show gonna be for my brothers and sisters to know that if you got people with high gate, yeah, I know how much I could give, Cecil. I ain't got no problem giving. I know how much I could give. But there's some folks who could give $20,000 and it really is only $20 to them. You understand that? I know there's access behind there where we could have gotten a U.S. Embassy show up, boy, today. U.S. Embassy show up today. The U.S. Embassy, Masi wasn't here for months. U.S. Embassy showed up today. Which relationship we tapped into to get that to work today? Huh? Whose relation? And this is listen. How many more people got to die? How many more? Who else got? Renwood Wells had a whole moment today in the house. Not a whole moment, but a moment. And condolences to him on the loss of his loved one. The condolences to Renwood Wells on the loss. So he knows. But how come in immigration, when they got immigration officers who passed away, members who are sick, positive with COVID, the building don't get shut down. There's no cleaning, no real cleaning of the building. People got to come back to work. There's no mandatory testing for everyone. How come when the passport office is running 2 deaths, people come back to work 2 days later? Were they tested? How come when you got people in the front line, y'all getting tested because y'all got to go to the hotel? Y'all got to work. At least the hotel care. But I don't know if it's about y'all.
No.
They care about their guests. They don't care about y'all. So what are we doing? Now the chamber wakes up. We got to deal with the surge. Now the chamber's awake. I've been saying as long as Bahamians are sick, you can't have commerce. So now commerce going to show up because the labor force is falling down like flies. Give me a break, man. And the people who try to, sorry, go ahead, Cecil.
And perhaps this is what we need. We need a national call out, you know. We should expect more from the Chamber of Commerce. We should expect more from our politicos. We should expect more from the intellectuals in our community. They all have a place in dealing and battling this COVID-19 pandemic, right? This plague. And it doesn't seem as if all of them are producing or doing their share or carrying their load, right? Have UB, University of Bahamas, contributed to the national debate, the national discussion? Are they included in that? Have they created any papers, any reports regarding on our response, lack of response, or the way forward? What kind of research papers, right? Have Rotary, have the Kiwanis come forward and say, well, we are doing this part to make sure that you have enough equipment. I heard that we don't have enough beds. I heard that we don't have enough ventilators. And you know, we've been here for a year. We as an organization will commit to bringing one. That's 2 big organizations, so we should have 2 more, right? From when the pandemic arrived with that one case to now. I'm not sure if we got any large equipment since then.
No,
surely someone should have been sourcing a building. Say, well, we know that the Princess Margaret Hospital, the Rand Memorial Hospital are taxed in terms of space. We will look for a building and keep the building out for in case of emergency, right? And these questions haven't happened because we didn't put the questions to them. And I know that it took some stress to have you emotive enough that now you're asking the tough questions. You're calling out names. I see you calling out some names. And perhaps earlier in the conversation, maybe last year, you should have called these names out and prick them and demand of them to do something now. That today, what is it now, August, that you would have had some results where you say, well, I helped with that. Perhaps that's what it is.
We need equipment. We need equipment. Enough of that rigmarole and dancing. We need equipment. And, you know, CA and you rejoining me, and the news that took me today, of course, was the passing of Dr. Susan Williams Lockhart's husband. She is still with us, and extending sincere condolences. It has been like, y'all don't know, just for the record, if you know Doc, she was loved and covered by her husband, and I don't know how Doc will. I don't know how she will do. And so even now, just thinking about it breaks my heart. Such a wonderful guy, and so condolences to the family. You know, it just leaves me sitting here though, CA, knowing full well that those who have are in a better position, but then they're still dying. People are still dying. It doesn't matter how much money you have. Yes, it doesn't matter how much
those who
money
have
you have.
insurance are also dying.
Yes.
It's not just poor people.
It is not just poor people. It is people are dying. And this is across all class and stratosphere. I want to say this though. You have to take care of yourself. Take care of yourself. You cannot in these times, if you are not, and vaccinations are not foolproof, right? You still have to wear your mask if you get vaccinated. You still got to social distance if you're vaccinated. So it ain't like you're vaccinated and you're immune. No. So don't feel all safe and cuddly. What the data has shown is that It may, in most likelihood, keep you from hospitalization and or death. But I want you to know we ain't sure which number, because they ain't foolproof there either. Okay, it ain't like it's 100%. It's still, yeah. So everyone, please be mindful. Take care of yourself. Don't. I don't even know what to say at this point, Cecil. There's so many.
And Haj, I want to interject because I love a better narrative. In the main, I believe that Bahamians have answered the call and are following the protocols for the best of their ability. We're not like France. We're not like the United States. We're not like United Kingdom, who are protesting in the streets, being violent and coming together in protest and taking off their mask. In the main, we are following the protocols. We are doing our best in terms of social distancing, sanitizing, wearing masks. I believe right now we are one of the better ones in the world.
Exactly.
Following that.
Yes.
The problem is we are now suffering from COVID fatigue. We are sick and tired of COVID, and it's becoming overwhelming for us. So saying the obvious, saying that you need to wear your mask when we're doing our best at following the mask better than some other countries, right? It means that we need to change our approach and how we deal with Bahamians in terms of what other incentives can we give you, right? To rejuvenate you, to get you energized to continue. You know, when you're running that quarter mile or that mile run, and sometimes that last 100 meters, you might say, man, I'm tired. I need to give up. You run fast all the way to 300 meters. You run fast all the time. So perhaps our government, our leaders, our NGOs need to come forward with some plan and some incentives and some emotional and enthusiasm and encouragement to have us walk the last mile and the last 100 meters and say, well, you can do this, right? And the constant badgering of Bahamians saying that you're not good, you're not going to be anything, that you're not doing it properly. It does something to the psyche, right? You don't tell children you're stupid and you're ignorant and you never accomplish things over and over repeatedly again. Why? Because eventually start believing it and you give up, right? And I'm kind of concerned about the narrative we're giving Bahamians, that you're not helping, you're not doing this. It's you to blame. You are stupid for not taking the vaccine. You make no sense. It dulls Bahamians on how they feel, so they get to the point of not caring, right? Becoming oblivious, and we don't need that, right? So we now need to perhaps find a new way, a better way of continuing this fight, new mechanisms, new protocols to continue this fight, because the fight belongs to all of us, and the least amongst us is our strongest link, right? And if we have Bahamians there who have some challenges at home where they cannot quarantine properly, we need to find ways to assist them. If we have some Bahamians who are home for 2 weeks and they cannot work because they have COVID, we need to go out there and assist them, right?
That's it. And you hit on it. And I think that there are, man, look here, this COVID thing, and we are in this wave now, right? It's different. I think a lot of people are feeling it because it's hitting faster.
Yes.
Right. It's hitting faster and it's affecting people quicker. So you'll be fine today, and the next day you're down and in the hospital or need to go into the hospital. Yes. For many, they don't have the ability to call. I mean, look, I just was on Noel's Nose, right? Formerly had Noel's group. And a young lady in the middle of the night asking if South Beach Clinic can take her husband, right? This is the level of panic that we're in, right? This is where we are, where you are watching your loved ones. I just found out today, a daughter from work and working at a government establishment took home COVID-19 to her parents. Her father has passed. Her mother's in critical care. This is like real life. And it has to be now where there are things that we can do, networking and working within our society, because the truth of the matter is, I don't know how the government plans on stopping this wave, right? For the first time, I heard them mention flattening the curve today in the minister's speech today, right? We're back. It's talking. I heard it, flattening the curve, right? They mentioned the only thing they could have done to flatten the curve then was we know what.
Mhm.
Now it's just tighter restrictions, right? Tighter movements. But people are catching it at work.
Yes.
And the workplace isn't telling anyone that there's positive cases. The workplace isn't being required or demanded to shut down like they say that they were supposed to.
Mhm.
The workplace want to continue work as normal, work as usual.
Mhm.
There's no, and you know what? Government institutions, we should have a data list of just how many lives have been lost
Yes.
from government institutions.
Yes.
And then what has happened when you have cluster events that start from the passport office? Did that happen? Can we see if there was any cluster event that started from the passport office and things are traced from there? Or did it trace from somewhere else? You know, I mean, like, this is where my frustration lies. But yet we're talking about COVID-19 as if it's something that we can manage when this thing has been outpacing us from the start. We've never caught it up, and you don't have the equipment necessary to save lives. But we're okay. We're going to be fine. I'm not confident. I'm not confident at all. I'm not confident at all, Cecil, in this administration's ability to deal with something once they've let the horse out of the barn.
And I hear you, and you have a right to be concerned, and the concern is warranted. But this administration, like many other administrations, responds to the public. The public have given up their right and obligation to fighting this COVID properly. There are certain questions we should have put to the government, certain questions the media should have put to the government constantly and demand answers, right? You wanted data and statistics, but none of the media houses, I mean, I'm exaggerating because, you know, Guardian does an awesome job. You know, make sure.
Yeah. Oh, yeah. We're killing it.
I can't come back on the radio. But they always do an awesome job, a yeoman's job, right? By pushing the envelope and asking the tough questions, right? But there's some of the questions you put forward that you're concerned about or information that you want has not been put forward to the government for them to even answer or to consider answer.
Yeah.
Because I want statistics. I want to know which hospital are the people them dying at.
Yeah.
Right? I want
it would be great to know, right?
10 people died at this hospital, 2 people died at this one, and whatever it is from COVID complications. I want to know where these people used to work. And I don't need to know specifically the company, but I would like to know these are government officials, you know, these are hotel officials, workers, you know, so I can understand, okay, I will know the constituency, the persons where they died. So this happened out east, this happened out west. So, you know, general stuff. So when I start contemplating and trying to understand and have a grip and trying to measure the seriousness of this, the soberness of this, to say, well, I'm going to take a vaccine. I'm going to encourage people to take vaccine. I can say to my auntie Iris, who live in Jamaica Road, hey, you know, they have a cluster in that Jamaica Road area. Make sure you have that vaccination and you don't talk to strangers. Don't mind the DNA coming campaign in your area.
Why got some of the DNA? That's the least of the group.
I'm just
They're
saying,
struggling right now.
They come to Auntie's house and says, don't come no more, right? Tell them, no, I'm scared of COVID. Stay outside. There's a cluster. But I don't have the data to tell her to be concerned. And that's why I'm concerned about. And we must demand this data. I'm not, even though I believe the government is obligated to give data, I don't necessarily believe they know which data is wanted, right? And they won't know which data is wanted unless you ask. And I'm demanding that you ask the tough questions, you put it forward to them, and in your future programs that you give suggestions for the government. I believe that the other day you gave some wonderful suggestions, and the public gave some wonderful suggestions, and I think coincidentally, of course, the Competent Authority came in and adopted 1 or 2 of those, or coincidentally, of course, right?
Coincidentally.
And I think that if we continue to say, well, these are the things that we need, that you'll see that our government will respond in kind and give us the information and the things and the equipment that we need. But we are not doing our part, and we are complaining at our part instead of initiating, sir, ma'am, I want to have this information. When can you give it to me?
We need the information. And but see, that's the thing. We've been asking for more data. Always been asking for data. Someone says, thank you so much for your passion. These millionaires 100 times over sit on the western side of the island and look down on us poor folks. West and east. Right, got some old school wealthy on the east, and refuse to help. And if when they get sick, they can pay to be airlifted. I don't think it's refused to help. I asked, you know me. I asked those who are connected to this group, and they said, well, they want to help.
Yes.
And I said, so what's the but? They want to help. I said, okay, well, how do they want to help? And they want to help with, they said they would provide testing.
Yes.
Ding dong, that's money. They would help with equipment.
Yes.
That's good. And they want to create protocols. That's where I paused. Okay, hold on. So I said, fine, protocols, fine. But, I don't think necessarily that, the wealthy should be in the Bill Gates business of trying to define things, in particular in health crisis.
But they have exposure, and they know.
No. Bahamas got exposure too.
Suggestions.
Hold on. Right now, I ain't worrying about that part. That part ain't important right now. You know what's important? The help with the medical side, the testing and the equipment. You want help with protocols, fine, and that's fair. That's fair. So I said to my friend, I said, that's fair. That's reasonable. To a certain degree, I understand. You want to make sure that things are, how these uses. They ain't talking about making sure things are used clear. They want to create protocols in line and in step with business and whatnot, the community, so as to grow. Okay, fine. That's fair though. What ain't fair to me, or what I asked was, is the giving of these things, the free testing or the equipment, is some of this now, is this something that only can be done if there's the protocol? Well, some things, in essence, they kind of stuttered. I said, see, because that's the problem for me. Give it out of love. Give it out of love. You give it out of love. You know who used to give, who gives all the time? Pastor Henschel. Out of love, just out of his goodness of his heart. How many churches and pastors, how many of you, Cecil, will give out of love out of the little you got? Hop in your car and help a neighbor. You give out of love. You don't give out of any fame or fortune. You give it from the abundance of your heart. You can't handle seeing people in despair. Just give out of love. Just give it. Just be one of those magnanimous, anonymous donors. Just do it. We don't need to know your name if you don't want people to know your name. But if some things got to be on, we need a hand, go hand, come. You don't love us. It's a negotiation. And I'm thinking at this point, ladies and gentlemen, we've given a lot of concessions to a few people who got a lot of money. And somebody got to start saying, for God's sake, you want to run the country? You can't donate equipment? It'll be easier to run it if we like you. That's all I'm saying. I think it's time long overdue for a break, but we got a caller. Caller, you're on the head back. Welcome.
Nahaja, how are you?
I'm well, and you?
Awesome. And to your guest, C.A. Nuri, good afternoon to the Bahamas.
Good afternoon.
Nahaja, I have a question for C.A. Nuri, since it seemed that he was on the way to Damascus and saw the light. I have a question for him. Mr. Nuri, how is it that these people are able to tell us what variations of COVID is coming out next, the month, the date, and the time it is coming out, but they cannot give us the accurate data that we need for anything else that we're asking them for? You can answer that for me, please?
Sure. What you're talking is basically conspiracy theory, but the humor is we know that the variant names in Greek alphabet, right? So what comes after alpha is beta. What have come after beta is what? Delta. What come after delta is gamma, and whatever come after gamma is whatever letter it is. So we know what names could be next, right? And I cannot say about the dates on why coming out or whenever they're coming out, but I'm sure that the scientists around the world are seeing trends, right? That they see different variants and they said, okay, we have a different strain coming out and we're doing tests on that. But that have nothing to do with us. It reminds me of a quote in the Bible where they was asking St. Paul, about the other doctrines, and said there are so many different books. And these people are not accepting the books, and these people are not accepting the doctrines. And Paul said, don't worry about those books. There is enough information that you have now and you need to worry about your salvation. And when you seek God first, all these other things and these other books will come afterwards. I find that what we're dealing with now is the COVID pandemic, trying to survive COVID. These conspiracy theories of where it started, who started it, how they have names beforehand, and where it's going to go has nothing to do with me and this Bahamas where you can't even see us on the map. We just water on the map, right? We need to be talking about how to save Bahamian lives. And that's our
it.
only narrative right now. That
Yeah.
too many Bahamians are dying.
Mhm.
Too many Bahamians are in intensive care. Too many Bahamians are taking oxygen in the hallway. Too many Bahamians are in a tent outside of the hospital, right? That's our only narrative we need to be talking about right now. I'm not concerned about what's happening in China with the COVID. I'm not concerned what's happening in France with the COVID. I'm not concerned what's happening in the UK with the COVID. I just want to know, what is it that we as Bahamians can do to fight this? Because we as Bahamians, if everyone else around the world die out, I want all 380,000 of us make it. We'll be the only, and then we could go and colonize other places. But we as Bahamians need to make it, and we need to find out whatever it is we need to find out to make sure that we survive. And so that's the narrative, and the only narrative I'm prepared to entertain at this present time.
I like it. Hello, Mrs. Black and guests. There's been too much evidence that shows we are not in the business of saving lives. People want normalcy in their lives, so they take the vaccine without the right information. Who really cares about Bahamian people? From Grand Bahama, we are listening. Nahaja, you know what protocols mean. If you work, you must be vaccinated. Hand go, hand come. Someone else said 2 people died who worked at a business establishment within 2 weeks of each other, and the business did not close or sanitize. The government needs to make it law to make these businesses sanitize. People are catching it from work. And so even with the evening lockdowns, right? Even with locking down at 9, personally, I'm never out that late. Well, obviously now working from home, I'm barely out at all. If I have to go out, it's in the day. It's the business day, right? Folks who work at the hotel, you have shifts, right? Persons who work at BPL and had like how many waves of COVID cluster? I mean, God, right? It's tons. So we know of incidences where accountability. Let's do this first, because I know I gotta go to break. Let's just say this. You know what vexes me? We talk about responsibility. Government agencies ain't been responsible. Okay? Bahamas Air to this day still comes in fully booked. Okay? Bahamas Air like Joneses. No, shout out to the staff. Love the staff. Just not what policies going on there. Okay? I know y'all like staff. They putting y'all at risk too. The whole flight coming in full with people who were told they don't have to do no PCR test. That was before. Now they got to do it. Right now they got to show up with a PCR test. But you're surprised Bahamas Air. I just was told the Bahamas Air staff died of COVID. Right? We're playing games. We've been playing games with people's lives ever since we decided that we had to go with money over people. Humans, the best will survive. How you gonna have the standard? You want to set a standard, but won't let their state-owned enterprises set a standard? If it's true that Ellsworth Johnson got sick from COVID, is not sick, but out from work because of COVID-19. If it is true, that is not a surprise to me, because I knew of immigration officers who were positive with COVID-19 in the building on Hawkins Hill. Never closed down. Staff finding out from sip, no mass testing at the job. We had a Speaker of the House lose his cool, call a House meeting just to row. Yeah, just to ask how you could disrespect me because you know my people sick and y'all won't have house. Y'all won't play house. But then the Prime Minister them could decide to suspend the House for weeks on end, knowing that they needed to have an emergency preparedness bill on the table before you go and dollar wine for 17, 16 weeks. But you want to come back now, extend emergency orders, and then you tell me you could give me a bill. And they're going to be consist building. Negroes, I must be the last conk. I must be the last conk, and I slow move in. I must be that. You see what I'm saying? Oh, but look at us go. Oh, but look at how we making it work. Can't give me nothing sensible. The Auditor General of the Bahamas say, you're spending money on these things, huh? You're spending money, but you can't tell me who the owners are in your emergency powers. How much more powers you need? You know what's going on. Too much money spending, Cecil, but we ain't got enough high flow oxygen.
It reminds you of that hurricane and money was being paid out, and no checks and balances.
None.
You know?
We got domes. We got domes with nobody in. We can't even finish 250 domes, Cecil.
But I meant a hurricane before that. But I understand your point.
Which one? There's one before Matthew.
I talk about shingles.
Oh, shingle.
A lot of money was spent out when you become a czar.
I was about to say something that might have gotten me sued. Let me
Now we have a COVID czar and money being spent out again.
We got more than that. We got COVID czars. We got food czars, COVID czars. We got finance czars. You realize in the recent days, we even got called on a procurement. Now they put this young lady's young, beautiful face out there to be the face of answers for financial, the Ministry of Finance. When all the time we know is the acting financial secretary, Marlon Johnson, taking the blows for finance. And they could put this young woman out there to now take blows for finance and their procurement. This foolishness. No. Last count. We got a caller. Caller, you're on the Hit Back. Welcome.
Hi, Ms. Black. How are you?
I'm well, and you?
Oh, I'm enjoying your show. But I think a lot of people who are not taking this vaccine, it's not clear whether they were to pass, die, and the insurance would pay. That's not clear. We don't understand, and at least for me, I am not taking it because you're not sure whether the insurance will pay.
That's
I've
true.
noticed people who had died, who had surgeries bypassed before there's COVID, and the insurance still say they have to investigate. So while we're coming on saying take the vaccine, people want to know, a lot of people out there want to know whether the insurance will pay. You're being insurance 30, 40 years, and you're going to take that vaccine, and so you die within 2 years, and the insurance doesn't pay. Where's going to put your family? So government or whomever needs to talk more about the insurance, whether the insurance is going to pay or not. Thanks.
Thank you. And that's a big one. People got real questions and issues and concerns. Now Pfizer will actually be very soon. And we're getting a bunch of Pfizer, right? A bunch of Pfizer vaccines. And again, kudos on whatever came out from that, I don't know, what do you call it? The agreement, right? By the US, but we were able to get this large number of vaccines, and Pfizer will be in that large number. And we were also told that Johnson & Johnson, and so Bahamas will have a choice.
Aja, I had my phone, my computer on mute, and I don't understand. Have a choice, and I let me slow down. Does it mean that I can go to the hall and ask, what vaccine do you have there, and I need this one? Is that the choice, or will they let the first one run out, and when that run out, we go on to the second batch and let that run out and go on the third one? And I'm also concerned. I remember initially there was a concern about storage of the Pfizer vaccine. Or it was a Moderna, I'm not sure. If you could remind me and correct me if I'm wrong. Did we correct that issue of storage facilities, like the refrigerator? Can you give me some? I don't know. I just don't know. I don't know what to say.
Yeah, at this point, I don't know what to say. We got to take a break. C.A. Nuri joining me here on the Hit Back. Thanks, buddy. I appreciate you. You've been the best co-hostess ever. We'll be back after this.
This is Guardian Radio, 96.9 FM, Nassau, Bahamas.
You're listening to the Guardian News Network. Good afternoon, everyone. I'm Taylor Ferguson. Here's what's making news. Thank you so much for tuning in. A 17-year-old boy today charged with murder appearing before Magistrate Samuel McKinney. Prosecutors allege the teen is responsible for the August 4th murder of Rudolph Roberts. The teen was not required to enter a plea. Bail was denied. His attorney informed the court that she was in possession of a doctor's note requesting that he be remanded to the Sandlands Rehabilitation Center due to his mental condition. The magistrate said he would make inquiries. Until then, the teen is remanded to the Juvenile Center at the Bahamas Department of Corrections until November 9th. There are 260 bodies in the morgue at Princess Margaret Hospital awaiting collection, far beyond the morgue's capacity of 75, according to Health Minister Renwood Wells. He said it's because families are waiting for a more opportune time to bury their loved ones.
The overcrowding, Mr. Speaker, is not due to COVID-19 deaths, but rather to individuals waiting for what they deem a more appropriate time to bury their loved ones.
Public Hospitals Authority sent out repeated calls for families to make arrangements to have the bodies collected, while stressing that if not, government will have to take the appropriate course of action. The Bahamas will receive 128,700 doses of the Pfizer COVID-19 vaccine tomorrow. Prime Minister Dr. Hubert Minnis announcing in the House of Assembly today.
These vaccines will arrive here in New Providence by flight at 1:30 p.m. tomorrow. This 128,700 doses of vaccine represents the first tranche of the total 397,000 doses that we would receive from the government of the United States of America.
Now, children 12 to 17 will be able to be vaccinated with the consent of a parent or guardian. And that's what's making news. I'm Taylor Ferguson. AP News is coming up next.
Coronavirus update. I'm Tim McGuire with an AP News Minute. The state of Mississippi is opening a 50-bed field hospital next to the University of Mississippi Medical Center, and the federal government is sending medical professionals to help treat patients as COVID-19 cases continue to surge in the state that has one of the lowest coronavirus vaccination rates in the country. California Governor Gavin Newsom orders all teachers and school staffers to either have been vaccinated or submit to weekly testing.
We think this is the right thing to do. And we think this is a sustainable way to keeping our schools open.
A number of corporations and other businesses taking the same approach. White House Press Secretary Jen Psaki.
Every company should take a look at how to protect their workforce, and that there are going to be different carrots and sticks that can be used by different private sector entities.
Threats were made against members of the Williamson County, Tennessee School Board south of Nashville after they voted for a temporary mask mandate for elementary school students, staff, and visitors. I'm Tim McGuire.
This is Guardian Radio 96.9 FM, Nassau, Bahamas.
Enjoy an elevated mobile experience with BTC, giving you
unlimited talk for the best conversations, unlimited data for all your online fun,
and unlimited roaming to stay connected while overseas.
For just $50 per line.
Unlock unlimited mobile talk, data, and roaming when you sign up for BTC Superfast Fiber Internet with speeds starting at 100 megabits per second. Enjoy more great savings and value. Upgrade or sign up today. Visit any BTC store or btcbahamas.com. Conditions apply.
When I got prostate cancer, my family didn't know if I was going to live. At Cancer Treatment Centers of America, within days, I got an appointment. They presented me with treatment options, and we set up a robotic prostatectomy. When my scans came back, there are no signs of cancer. They don't see you as a number, they see you as a part of the family. I'm going on with my life. That's a real gift.
Call us at Cancer Treatment Centers of America.
Many people wonder, what makes Boost Academy unique? Maybe it's our 8-to-1 student-staff ratio, the emphasis we place on student individuality, our focus on numeracy, literacy, and creating better citizens by sharpening students' critical thinking skills. One of our many talented teachers, program facilitators, and mentors. Or just maybe it is our commitment to taking full responsibility for your child's education. No hidden fees or costs. Regardless of what it is, let us help your child reach their full potential. Boost Academy is currently enrolling students of grades 4 through 12. Visit www.boostbahamas.com to apply now.
Tired of banks forcing you to use technology to bank the way they want you to? Your convenience is important. So no matter what your banking needs, Commonwealth Bank's friendly staff are always available in branch for that personal one-on-one service. But when you choose technology, our online and mobile banking app offers you state-of-the-art functionality. The choice is yours. Commonwealth Bank. Bank the way you want.
It's the hit back with Natasha Black. It's the hit back with Natasha Black. It's the hit back with Natasha Black. It's the hit back with Natasha Black.
And we're back. You're listening to the Hit Back with Natasha Black. So just some clarification or something. My good friend, reporter, senior reporter and superstar Carl Joaquin, in an interview he did today afterwards with the Minister of Health, confirmed that we will be able to choose which vaccine we want to take. And when the Johnson & Johnson vaccine comes by the end of the month, you can choose whether you want that too. So there will be choice between the AstraZeneca, Pfizer, and Johnson & Johnson vaccine. So that is good news for folks who want the choice, and that is an open choice for you. Again, you're listening to the Hit Back. It was sad news today, but we'll get to that on another note because I want to switch gears. Something that has been going on also during this pandemic, and we discussed it, and it was said at the beginning, you know, what would be some of the causes. When Dwayne was the minister, then he mentioned it, that this pandemic will take a toll on a bigger group of people, just straight across the board. Lockdowns, what they do, how they affect you, what would the economy, the changing in the economy, how it would affect personal lives, people, right? The human toll, not just on health, but on mental health, on our personal ability to navigate and be. And one of the things that has come out of this time, it was the increase in domestic violence. And I wanted to do this show, and I refuse to let anything take me away from it, because these are the things that are going on under the mask of booming economy, under the mask and the energy of campaigning. When there is less, more happens. We know that there's a lot of things that can cause friction. We already know we had issues with the domestic violence. Something like this is even more so. And so I want to have joining me a special guest, two special guests. But before I do that, I want to say this to someone who's watching right now. Patrick Jackman, please email me, Nahaja, Nahaja, @gmail.com. Patrick Nahaja, Nahaja, @gmail.com. We need to connect. So I've got joining me right now, though, a good friend. He has been on the show numerous times, always giving his vast levels of knowledge to the show. He's been on a few times, and we were talking about gambling addiction. And I want to welcome him. And then also will be joining us as the director of, and all of a sudden I can't remember, so he'll remind me. All of a sudden I can't. National Drug Agency. Is that it, Sean? Okay. Let me bring on my good friend. Let me start wasting time. Dr. Sean Knowles. Sean, how are you, my friend?
Yes, good afternoon, Naja. Always a pleasure to be here. I feel like the Dr. Phil of your show.
Yes, you are. You are definitely the Dr. Phil of my show for sure. It's good to have you on, buddy. It's good to see you.
Yes. And Dr. Carter will be joining us shortly. She just went out a few minutes late.
That's right. And I'm so excited to have her as well. This is an interesting topic. You know, I called you some weeks ago because I wanted us to have this discussion. Yeah. Domestic violence is a real thing. It needs more attention. We need to get out of it being something that just happens or that's undercurrent and whatever this is in our social psyche, and realize and getting a sense too that this is happening concurrently to all of this pandemic thing. This is happening, increasing. So let's get a sense, Sean, Dr. Knowles, Sean Knowles joining us. First of all, define it for me. Domestic violence. What is it?
All right, so domestic violence, it's also known as domestic abuse or intimate partner violence. And it can be defined basically as any pattern of behavior in a relationship that where a person uses it to, manipulate a person or to gain some power or control over that individual. It can range from being the abuse that is, can be physical, it can be sexual, it can be verbal, economic. Some people don't think of it that way. Of course, emotional and psychological. And one thing I want to highlight too, it's not just men using domestic violence on women.
That's
but
right.
The other way around. A lot
That's
of
it.
men are also being abused by their female counterparts. And so it's important for us to have this conversation, Nahaja, because it's going on and we have been sweeping it under the rug for too often here in this country. And so I'm so excited that we're able to talk about it, and especially in light of the COVID-19 pandemic.
Yeah. Well, then let's talk about that too. How has COVID influenced this issue or this phenomenon, this thing that's affecting people across the world? Has COVID made it different? Has it increased the prevalence, decreased it? What is going on with it, with our country?
Without a shadow of a doubt, the research that is out there, and of course more research is being done, but the research already that we have is shown that it has escalated the amount of domestic violence. So if I can give you few statistics. So one of the papers that I would have read noted that 1 in every 3 individuals worldwide have been experiencing domestic violence since the onset of this pandemic. I notice it said individuals, meaning it's not just women, but it's also men as well. Another statistic that I found to be very staggering was that in China experienced a dramatic increase in domestic violence, such that they found that 90% of persons who were isolated and locked down due to COVID-19, they reported a threefold surge increase in the amount of domestic violence in 90% of the persons over there. In the United Kingdom, in a span of 3 weeks, from March 23rd to April 20th, they found that twice as many women were murdered by their domestic counterparts during that time, that short space of time, when compared to the average annual statistic, all because of the effect, the impact of COVID-19. And I can give you some more research that definitely substantiate that COVID-19 has had an effect on domestic violence.
Why do we say so? What is it? Because of the lockdown? Is it because of being in constrained spaces? Is it because of stress? What has happened?
Yeah, it's multifactorial. I mean, the stress of being the lockdowns in just about quite a few nations around the world would have had to have been locked down, the Bahamas included. The stress of finances being an issue. Because people turn to substances now to try to cope, you now have a substance use on board. And so a person who is drinking excessively loses their sense of rationality. And of course, once it gets to that point where they're angry and frustrated, that can turn into arguments, which can turn into abuse, domestic, and as well as, of course, physical, sexual, and emotional. And so it's quite multifactorial. It's important, I think, for us to get the message out there that there are ways to handle the stress that you're going through. Turning to substances is not the answer. Turning on your partner, for whatever reason, is not the answer. You have no right to be hitting another adult, and so we need to be able to voice this. Anybody who is going through any kind of abuse should have that opportunity to voice that so that they can get the help that they need. And I'm totally against, Nahaja, if I can be very, very strong, in my opinion. I know a lot of religious people feel that if a husband and wife are together, that they should remain together despite one of the spouses being abused. I disagree with that.
I disagree with that too.
Abuse physically, that could be their very end. And so
that covenant is broken.
Yeah, definitely. And then children, we haven't not even talked about the impact of children that are seeing this. This has long-term consequences because it not only increases their sense of anxiety and depression, but it also causes them to think that violence is normal, the way to go. And so that can be perpetuated through generational lines. And so this is a serious issue. And again, we need to have the conversation. I need people to come forth who are in this scenario, who are experiencing these kinds of situations, to come forth, get the help before it becomes too late.
Let me ask you, Sean, one of the questions, I heard, and what kind of fueled me to even reach out was there was a story being told, and I remember someone was telling the story, and in my mind, I asked the question, why do you stay? Why would you stay in an abusive relationship, man or woman? And as I was asking that question, I realized that was weighty, convoluted, many reasons why people stay. And I wondered, in the pathology of abuse, right? What makes someone stay in a situation that is abusive?
Oh boy. And you always hear sometimes, and it baffles me too, the person say, well, I love him or I love her. I think it has to do with self-esteem too, Nahaja. Persons who have such a low self-esteem feel that they can do better, especially if their significant other has been hammering that in their mind. It's almost like mental slavery, that you have no other choice but to be with this person, whether or not he or she is supporting you financially, whether or not you have kids with them, and you feel that in order to make the kids happy, which seems to be somewhat of an oxymoron, that you have to stay in this relationship. And so it's quite multifactorial again, even the whole notion of domestic abuse. I will say this though, if it comes to that point where you have to rationalize to be in an abusive relationship, be it physical, sexual, emotional, or psychological, then that pretty much is a red flag that you need to get out of that relationship, that you are going to need help for yourself, because it's not healthy. It's not, I don't want to use the word normal, but it's not a good quality of life where you are constantly on edge around somebody because you don't know when he or she is going to fly over, when they're going to hit you, or whether they're going to throw words of abuse to you. And if you have children, young children who are seeing this, think of the kids. They should not be exposed to that. That is damaging to your sons and to your daughters. And so that's why I say you have to get out of that relationship, even if it's temporary. Get help for yourself, and certainly help for the person who's doing the abuse.
When does it, there's a lot of abuse where it's control, whereby they control your money, control how you move. Is every abusive relationship leading to a very bad outcome? Right? Like, so there are there varying degrees of abusive relationships? I think that's the question.
Yeah, and that's an interesting question. I will say this, there's nothing good about being in any kind of abusive relationship. It's a negative connotation on the whole, despite whatever degree, whether or not a person's hitting on you. But if you have someone who's verbally beating you up, telling you you're no good and you're this and you're that and so on and so forth, to hear that day in and day out, that affects you psychologically, and to the point I mentioned, low self-esteem. Some people say they would rather persons beat them than to have to deal with the verbal abuse. But the fact is, none of it is good. None of it is healthy. And I often say this, in the words of Medea, I can do bad all by myself, Nahaja.
Yeah.
And people, I find, don't love themselves. And when you have a low self-esteem and you don't love your self-worth and appreciate who you are, you allow anybody to do anything to you. But let you have that confidence in yourself and realize that, hey, I'm fearfully and wonderfully made in God's eyes. I'm a beautiful person. I deserve the best. Once you get that headset on, you realize you ain't taking no abuse from anybody. It ain't worth it.
Dr. Sean Knowles joining us on the show here. One of the things, and I wonder if the catalyst why there's such an increase in abuse during COVID-19 is also because of the economic challenges that people are facing, right? We were having economic challenges before COVID-19. Before Dorian, people were financially strapped. Then things got immensely worse. We're finding that we're living in closer quarters, more people in a space, or there's financial stress. Are people staying because they have nowhere else to go? Are you seeing that that's some of the data that's for us? Is that what's going on?
So that seems to be one of the prevailing factors. But again, I try to substantiate what I say by research, so it's not anecdotal. And even as far back as 2001, Dr. Bernard Galloway, she had interviewed 313 women at the Princess Margaret who presented to A&E. And at that time, her studies found that 40% of those women reported being physically abused. 22 reported sexually abused. 39 reported being verbally abused at some time in their lives. And one of the things that she also looked at what was the common trends. And she found that the perpetrator was generally a boyfriend or husband with risk factors including younger age, being single, low level of education, substance use, economic hardship, and crowding in the home. And so when you look at that now in the context of research here in the Bahamas, especially on New Providence, you get to appreciate what some of the risk factors are. And so, yes, so a lot of it tends to be tied to the fact, economically, this man, for instance, is taking care of me. He's helping to take care of my 3, 4, 5, 6 children. And so they feel that they have to go through, in the context of a female, they have to endure this kind of abuse. And again, I repeat, you have to think about the children. I'm seeing, Nahaja, and again, this is anecdotal, but even now working on the substance abuse wards, where I talk to some of my male clients, for instance, a lot of them experience or witness the abuse early on in life. And they remember that. That is like a psychological scar. And they would tell you this is how they turn on this path of marijuana use and substance use. Either they were abused or they witnessed their mothers being abused. So, even in that context now, these young people in their 20s and 30s not only have to deal with an addiction, but you need to help them go back to deal with the root of the problem, especially when it stems to them even being the ones being abused physically or sexually or verbally, or witnessing their mothers having to go through that. And so
this is powerful too. But I think it's so important that you hear this, that it is not just that they'll see it and end up being an abuser, but they might end up being an abuser of drugs, end up not being able to function in school and work, and find themselves in a spiraling space. That's deep.
And if I can really hit the nail on the head, and I don't want anybody to attack me for this, but for a lot of persons too, they will tell you in the case of females, they don't want to be in a relationship with another man because they have that fear of the fact that they witness. And so they turn to the same-sex relationships. So it's not healthy in the sense that they now have that view that because they saw their fathers, for instance, beating up their mothers or attacking them, they feel that all men are that way. And so that leads to a cycle of even them becoming very promiscuous, or on the flip side, or the other opposite end of the spectrum, not having any sexual or any relationship with another man because of what they would have witnessed. And the same is true for boys.
Wow. Hold on, man. Dr. Knowles, that's a big thing. I mean, and it shows you that the impact of it. And it makes me very nervous because we're talking about a country that's already small, that has so little people. And we have an issue where this is pervasive in our country, in our culture, to a sense where, and I think you can remember, Doc, we recently did, I think it was last year, 2 years ago, 2-3 years ago, where there was some sort of survey done. And when it was asked to women, if you saw a woman or you knew a woman was abused, their response to it, were you okay if she was abused because she was cheating? And we had a good number of women who said, yeah, I mean, that's reasonable, right? That's concerning to me that that somehow it's okay because of a consequence. So it's the abuse that comes from consequences more okay than just random abuse. And as if we've normalized this process of abuse. So that's where psychologically, I think we need a lot of work. And maybe that's why, Doc, I don't hear much about this discussion in COVID times. We're like, people got more issues, more pressing, worrying about people getting beat up, man. We can't eat. And that to me is very concerning that we're not talking about this enough. The family unit, you hit on it with the kids and how that impacts the children. You mentioned do it for the children, but where can people go? I don't, has there been an uptick in safe houses since the pandemic?
The sad part about all of this, Nahaj, and I thought about this because of the context of COVID-19, a lot of services have been either suspended or somewhat downgraded because of the fact you're trying to mitigate, any kind of personal contact. And I don't think that is the way to go in the context of domestic violence, because someone who is at that point of almost no return, have nowhere to go, what is he or she going to do? It makes me wonder about the persons who are out there who, because the services that we would have had before COVID-19 that would have been maybe available, it was difficult trying to get people to reach out then. What if they now because of they feel trapped and now they need that help. Where are they going to turn to? Thankfully, I would say start off with the Royal Bahamas Police Force, report it to the police, and hopefully if there are any police officers out there, I need them to take this seriously, whether it's a male or female. Don't laugh if a man comes in because he is at a point now where he is being so abused by his significant other.
Yes.
He comes for help, and then you turn around and you make a big deal about it. You laugh about it. That's sad.
That's wrong. It's wrong.
Yes, very wrong. And I think we need to have our police officers now educated about the importance of domestic violence, both from the context of male and female, as well as not only females and children. So I would encourage persons for right now, and I hope Dr. Carter can join us. She would definitely have more information to provide. But I know that there has been some suspension of those services that would have been available. But again, I do encourage persons who feel that they have nowhere to turn. If they can't turn to their church or they can't turn to somebody who can help them, please turn to the Royal Bahamas Police Force or even reach out to your physician and we can help them direct them to the best place possible at this time.
That's a serious thing where you say, hey, listen, right now, certain services have been suspended because of COVID-19. And, that frustrates me, Doc. It really does frustrate me because we know certain things are happening and it's like we're missing the holistic part of this pandemic and how much is going on. Of course, resources are limited. The crisis center, is it still up and running?
As far as I know, they should be. And I have that number to give. I do have the crisis center number. I can't confirm if they're really up and running. I know we would have referred, from my recollection, from working at Sandilands, at least 2 females at the time. And so the crisis center, if I can give that number, I see it is 328-0922. The crisis center, 328-0922. They should be available. Even if they're not able to take anybody in, they should be able to give some advice, very important advice. But again, the basic would be if you can't reach out to them, can't get through, please go to your nearest police station, reach out to them, and then somehow we will get persons to get them the help that they need.
Yeah. I'm going to take a quick break. I see Dr. Novia Carter-Luque just showing up. So we're going to take a quick break and come back to this. But there's folks who are saying, listen, women get abused at the same rate as men. Is that actual? Is that, like brothers just want to always, make sure that their voices are heard equally, even if the case ain't, and some brothers are just sensitive on that one. But I do agree that men do get abused. I have a friend who's willing to tell his story. And, what I can't stand is how men are seen to be, punks if they don't hit them back. That's a good man. Don't hit her. If you hit her, you'll knock her the next week. Right? That's restraint. That's good upbringing. And if she hits you, I know you. Listen, if anybody hit me, they're going to be some furniture moving. There's some furniture moving. Furniture can move. I might not win, but I can throw blows. You walking, but that's me now because I came up now. I'm strong and individual, but people go through things when they're younger and they're not given that strength. And you meet a Ted Bundy type, this thing is deep. This is deep. We're going to be right back. When we come back, some more with Dr. Sean Knowles. There's a lot going on in this COVID pandemic. Along with losing people are losing their sanity. And one of those issues is constantly being, we have to discuss it, and it's uncomfortable for some, but it's very vital that we discuss it, that this is also part of it. We're having an uptick in domestic violence in this country, male and female, both, and both same sexes as well. That's a whole other story. It's a whole kettle of fish, boy. Domestic violence don't care. Relationship is relationship, and people are fighting. And we need to find ways to help folks get out of dangerous situations. What are the red flags? We'll be back right after this.
Throughout our lifetime, we must all make decisions. No matter how we choose, the right one just needs to be made. Like having J.S. Johnson Insurance Agents and Brokers as your insurance partner. We've been serving the Bahamas for over 100 years. Whether you need home, motor, marine, or commercial insurance, make the right decision. Call 397-2100 or visit jsjohnson.com.
JS Johnson Insurance. Peace of mind.
When I got prostate cancer, my family didn't know if I was going to live. At Cancer Treatment Centers of America, within days, I got an appointment. They presented me with treatment options, and they said a robotic prostatectomy. When my scans came back, there are no signs of cancer. They don't see you as a number, they see you as a part of the family. I'm going on with my life. That's a real gift.
Call us at Cancer Treatment Centers of America.
Rejuvenate, refresh, treat yourself. Immerse yourself in total comfort. Pamper yourself. After all, you're worth it. Relax. Rid yourself of all life's stresses. At Baja Retreat Anti-Aging Spa, you will find everything you need to enhance your body and spirit. Call today at 323-6711 and begin your journey to serenity at Baja Retreat Anti-Aging Spa.
Enjoy an elevated mobile experience with BTC, giving you
unlimited talk for the best conversations, unlimited data for all your online fun,
and unlimited roaming to stay connected while overseas.
For just $50 per line.
Unlock unlimited mobile talk, data, and roaming when you sign up for BTC Superfast Fiber Internet with speed starting at 100 megabits per second. Enjoy more great savings and value. Upgrade or sign up today. Visit any BTC store or btcbahamas.com. Conditions apply.
This is Guardian Radio 96.9 FM, Nassau, Bahamas.
It's the hit back with Natasha Black. It's the hit back with Natasha Black.
And we're back. You're listening to the Hit Back with Nahaja Black, Guardian Radio 96.9 FM. Hope that everybody's doing well, taking care of yourself. And we're back. You're listening to the Hit Back. So I hope that everybody's doing well, taking care of yourself, and enjoying your day. Of course, the sad news coming out of this morning was the loss of a friend of the show, and a friend of mine, a wonderful woman. Her husband has died of COVID-19 this morning. Dr. Susan Williams Lockhart, you know that she's in the hospital right now with COVID. And this morning she was given the news that her wonderful husband, Laverne, has passed away this morning. So sending all my love to them and that wonderful family, as she was always on the road with him, taking care of us, right? And she showed up for my mom so strong. And Laverne was there always as her right hand. So Doc is still with us, thankfully. But this morning is as if Doc lost a part of her. And he was a wonderful human being, man. And another number in this COVID battle, another life lost. So sending love and life and prayers to the Lockhart family. That one is still going to hit me for a while. I mean, just spoke with Laverne. What was that? The last time he and I spoke was Thursday of last week, and he was talking about her, like how was she doing, and letting me know how she was doing. And I hadn't heard from him, and now he's gone. So this is the reality of COVID-19. So please, everyone, be safe, social distance, mask up, double up if you need to. Don't go into any enclosed spaces, vaccinated or unvaccinated. Just this Delta came in on Delta. I'm sure it came in flying high, and now we are low, and we can't handle it. And what is going on with all of this, and with every more restriction, is that we are forced to be amongst each other and to stay amongst each other. So I'm going to bring on Dr. Sean Knowles and Dr. Novia Carter, these beautiful humans who are working tirelessly on the front line for us. Dr. Novia, how are you, darling?
I'm good. I apologize, Dr. Sean. I apologize. Black, I apologize for my tardiness, but we're just trying to do so many things in a few hours.
I know. And you're busy and working, both of you. And can I just say, for the record, thank you to both of you for doing what you've been doing and keeping your services going and helping people, mental health, the National Drug Council, all of the work that you guys are doing in the midst of a pandemic, and knowing that you're always on the front line. So thank you. I appreciate y'all, and the Bahamas stands and calls y'all a hero. I don't know about everybody, but I call y'all heroes. That's the truth. So thank you. All right. This conversation here, then, that's why I think it's so important to have it. a group of people in this country called the Commonwealth of the Bahamas are experiencing domestic violence. Silently, there's a few people who know in their circle, but by and large, they're going to work and they're functioning, right? They're dropping their kids to school and functioning. The husband or boyfriend is going to work. Everyone's functioning to some degree, but they have this secret, and it doesn't matter the class. We know it's rich, poor, middle class. It doesn't matter. For us, and Dr. Novia Carter, I want you to tell me, from what you've been seeing in your department as the director, where are we with this domestic violence issue in this pandemic?
Well, the interesting thing is it's not just unique to the Bahamas. Internationally, we've seen an increase in the levels of domestic violence. When we look at the work that we do at the Bahamas Crisis Center, we've seen an increase in the number of persons who are calling into our hotline saying, I'm going through something, I'm being physically abused. But what I want people to also take into account is this. When we talk about domestic violence, we're not only talking about the hitting, we're not only talking about rape. When we talk about domestic violence, we have so many people who are going through emotional and psychological abuse as well. And so when I first came into the conversation, you were talking about men. And so, no, a lot of men may not be physically assaulted by their wives, but a lot of men during this season are broken because of the psychological and emotional issues that they're going through within their homes. And so it could be as simple as a man knows that his role is to provide. And when he is unable to provide, the wife may make one simple statement and that can break that man. A child may say, Daddy, you can't even buy me an ice cream. That breaks that man. And so when we look at domestic violence, don't only think about the psychological abuse. Don't only think about the physical abuse or the sexual abuse, but be mindful that the emotional and psychological abuse is even more damaging.
But people don't report the psychological abuse, right? It is bad words. Like, when do you decide that these bad words have reached a crescendo? What is the impact of the bad words?
I use, like I said, I still springboarding on the conversation that the two of you were having that I came in on.
Yep.
The interesting thing is, for us as women, we could sit down, I could call you Nahaja, and guess what he say to me? And Nahaja, guess what he do? And you're going to help me walk through it, baby. We got this. But if Sean is being abused, Sean is going to sit to the bar and he will not tell anybody what he's going through. He has to be a macho man, and so his wife then beat him down into the ground, and the only thing Sean can do is swallow. And so and have a few more drinks, and have a few. And so that's the difference between how our culture accepts what can happen. Even if a man is being physically abused, he can tell no one. I could call you Nahaja, that man hit me in my head. Nahaja, and he kicked me and he punched me. But Sean has to take it if he's being beaten, because he feels as if he can't report it to the police. He can't tell his boys. He definitely can't tell his family. And so he sits to the bar and has another cocktail.
And smiles with it.
Another cycle.
And Sean, you want to add something to that?
Yeah, so one of the things, Nahaja, even from what my dealing with men at Sandilands and even at my clinic, I have been finding that a lot of men, their family members may say they notice a change in his behavior. Like, he just became just so angry and so agitated, not himself. And when I do a depression screen on quite a few of these men, they're scoring extremely high on the depression. And so I say that I agree with Dr. Carter very well. And because he feels he can't tell anybody, because we're being conditioned as men that we can't talk our feelings, we go ahead and we either drink or we smoke or we try to do some other kind of vice to deal with the pain and the issues that we're dealing with. And so that is going to turn around and become a problem later on, if not sooner rather than later. And as a result of that, the message is clear. We're trying to reach out, not just to women, but also to men, to be able to reach out to somebody when they are at that point, when they're not feeling themselves, when they're feeling depressed, as opposed to depending on the alcohol and the drugs to try to ease their pain.
Yeah, no, I think And I'm happy that we're doing the show here. Dr. Sean knows, Dr. Novia Carter-Luki, and you're listening to the Hit Back with Nahaja Black. We got a caller on the line. Let's get this caller real quick. Caller, you're on the Hit Back. Welcome.
Good evening, Nahaja Black. How you doing?
I'm doing well.
Man, we missed you like water. Okay? Now, I want to say this to you, Nahaja. Over the last several weeks, you've been having a whole lot of doctors coming on your show to talk, even today, about abuse and to talk about this COVID-19 situation.
Mm-hmm.
I am living in the COVID-19. I never had it, but my wife is a licensed nurse, okay? The lady who husband died, I'm a lockout. He's a lockout, so we have to be related. But I want to say this to you. Yesterday, you had Dr. Michael Dabble on your show talking about this COVID-19 and his 10-point plan with the PLP hub, and he's saying it ain't political, and the FNM ain't saying it's political. What I really want to know, for real, since we want hit home at this, does the doctors have a doctors association? Because since we have a pandemic in this country where our health is at the most risk in the world, we should have a doctors association with doctors speaking on the seriousness of health in our country, so we know it ain't gonna be political. You understand?
Mm-hmm.
Our country is in a crisis as far as health is concerned. And we don't need no politicians to come up to your talk show or any talk show to talk about what point plan they have for our nation, whether they in governance or not. We need the doctors to tell our people how serious this thing is, and what we need to do to either eradicate it or find a way to treat it. Okay? This your friend. You used to call me one name, and I stopped calling your show because I didn't want to be identified with that name on any show. But this your friend who speaks with plenty passion. One of these days, I'll call you. But
all right,
the serious situation is this pandemic. Okay?
Thank you, buddy. I got you. For the record, the doctors' associations have been speaking, junior doctors, consultant physicians, therapists. They have been speaking about, the severity of this pandemic. Let me ask this. Dr. Sean Knowles, Dr. Novia Carter-Luki on the show with us. The mental health side of this, because you guys hit on it, and we were talking, and the main premise of this was domestic abuse, right? Domestic abuse. And I love how we're hitting it on all fronts today. The impact of it on families overall, the mental health side of it, depression in country right now, right? You guys kind of touched on it, and Sean, you just mentioned it. Depression in country. What would you say right now, both of you docs, on where we are? Do we have any data on the levels of depression since March 2020? Do we know where, in terms of suicide or attempted suicides, have we spiked? Is it over more so women or men over women? Who are more successful? How is all of this affecting us socially? And who wants to go first on that one?
Me? Okay.
Sean, go first, Sean.
All right, I'll go first. So let me say this. I don't know of any data currently other than what was done back in 2018 by the Ministry of Health. And I think Dr. Dwayne Sanson, who was the then Minister of Health at the time, had talked about it when they found about 17% of the adult population, based on the studies that they did at the time, the surveys, who wanted to commit suicide or who thought about committing suicide. That was before the pandemic. I can only assume now that that's probably has been heightened, especially last year. And sadly, we lost a few men last year. I don't remember the number, but I remember that there was more males who ended up dying by suicide last year in the heart of the pandemic. And I say all of that to say, back in 2013, the World Health Organization, they had predicted that by 2030, depression is going to be the #1 disease. Because of the pandemic, I believe we are now even closer to that number, with depression being the #1 disease, as opposed to in 2030. You have a lot of people who are depressed clinically depressed. And I gave the example about the experiences some of the men that I've been working with. When I do the depression screen on them, they're scoring very high on depression. And so people are walking around pretty much, they may show a smile, they may try to mask the pain that they're going through, but deep underneath that, there's a lot of depression going on. I'm seeing a lot more anxiety too, as it relates to the whole pandemic that has started. And interestingly, not just in adults, also in children and teenagers whose lives would have been impacted because of this COVID-19. And so major depression, that has to be atop of our minds when we talk about mental health. Anxiety, generalized anxiety, also needs to be up there. In the context of domestic abuse, not only those two, but also post-traumatic stress disorder needs to be up there. I'm wondering now how families are coping because we're losing so many people to COVID-19. Yeah. I can only imagine that that's cause even more depression. Yeah. So it's imperative that as best as we can, we try to provide the mental health services so that people can get help when they need it.
Director of the Bahamas National Drug Council, Dr. Novia Carter-Loki. Doc, what are your thoughts on it when you look at from in your work? What are you seeing?
Well, we're going to look at it, Doc. Once again, we do not have data to support it. We just simply have a lot of anecdotal incidents. I'm going to end talking about the children. We're back going through financial abuse, all right? And so as a result of money stress and money being a problem, you have some men who may simply say, well, I'm not going to provide this week because you didn't do this or you didn't do that. And so that adds another stress to the family. And so you have a lot of school-age children who are severely depressed. Why are they depressed? Not being able to participate in their social activities, not being able to be involved in sporting programs. The greatest one and the source of the greatest anxiety is the lack of them being able to perform in their social atmospheres. And also, a lot of these kids feel stressed out about school. They feel stressed out that I used to be an A student. Now I'm getting C's and D's. I'm not doing as well as I used to do in school. I'm not seeing my friends. Why are my grades so low? What's going to be my future with education? And so right now we have a lot of kids who are suffering from depression and anxiety as a result of COVID.
Wow. For me, we needed to hear this. And I know Dr. Novia is on the road. So we're, of course, challenges with the internet there with her. But for me, I think this is important that we hear this and be reminded that there's a lot of other social things that are going on at the same time. How do we as a community, how do we as neighbors, Doc, understanding or knowing now that, hey, there's certain, facilities, certain departments because of COVID are not working as functioning as they should. How can I be able to help? How can we as a community spot depression? How can we spot domestic violence? What are some of the things that we can say to someone who's being abused verbally, physically, that can probably help them? And then where do we refer them?
Yeah. So what we're doing now, Nahadra, we're talking about it. All right. If we don't talk about it, people are not going to be desensitized. People are going to continue to kind of hide it, when in reality they are suffering behind the scenes.
Yeah.
I think this, I pray, is a starting point for persons who are out there and who recognize that, hey, you know what? Mental health is serious. It's important. It's okay if I'm not feeling myself. It's okay for me to reach out for help if I know that I need it. And I think once we get that message out there, that's going to help persons to be able to reach forth. You mentioned a very important point, what resources are out there. And if I can name a few, and I know Dr. Novia, you will be able to share some examples as well. But there's the Community Council and Assessment Center on Collins Avenue that's open to the public. Of course, with the COVID-19 situation, we do encourage persons to call ahead of time to schedule an appointment, but that is a resource that's available. Churches is also a great place to start, especially if you have a relationship with a pastor whom you trust. At least you can turn to him or her, and if they are unable to provide the necessary mental health that you would need, then they can in turn refer you to services such as myself or Dr. Carter, persons at Sandman's Rehabilitation Center, and we can be able to help that person. your personal physician. Physicians should have an idea of when someone is when they're going through mental health challenges. And so even if they're not able to provide the help, they can again refer to psychiatrists, psychologists, persons in the mental health profession. All right. So the underlying point, other than us desensitizing people, is to start somewhere. Reach out to someone, and once you've reached out, let's see where it takes us. And hopefully it can only help you become the better person that you need to be.
Yeah. And someone wants the phone contacts for both of you. So guys, send me your number so we can make sure people know how to reach you. And I'll start with you, Dr. Novi. But before I let you go, Dr. Novia, what would you say are marked red flags? How to know you're in a troubling relationship, male or female? How do you know that you're in a red flag relationship?
When you feel like you're starting to lose yourself, when you feel as if you can't express how you feel, when you feel as if you have no voice. The biggest one is when you feel as if you have no voice. Even in terms of our children, when you feel as if there's so much fear inside of you that you can't even function. You feel depressed, you feel sad, you feel overall as if life is hopeless. That's the greatest sign that something is wrong. And for parents, when you notice that things that your kids used to love to do and enjoy, they're no longer doing it. They're withdrawing from you. Then you know that my baby has a problem and I need to jump on it right away.
Let's get some contact information from the both of you. Dr. Novia Carter-Loki here with us, and we have Dr. Sean L. Knowles with us as well. How do folks reach both of you? Dr. Novia, we know you're the big boss. You got a whole department. How do folks reach?
The Bahamas National Drug Council, we're available online. We have somebody who will respond within 15, 20 minutes. The biggest way to reach us is simply 242 Bahamas National Drug Council. Help and hope is available by contacting the National Drug Council.
242 Bahamas National Drug Council. I like that. And she had a whole tagline and everything. Help and hope. I love that. Dr. Sean Knowles, how do people reach you?
Sure. So I'll give several contacts. So my Sandilands contact is 364-9657. 364-9657. That's to reach directly on the ward where I'm at. My office number is 393-9355. 393-9355. And we also have a hotline number. I'll give that as well. 437-6026. 437-6026.
Yeah, no, that's
I typed it in the chat box, so that way
you're the best. Yeah. You're the best. I put them all. They look like Greek. So, Doc, thank you so much. Appreciate you. Dr. Novia Carter, of course, with some challenges there with connection, but thank you so much. I appreciate the time, my friend.
Yes, you're very welcome. Thank you.
All right. And my pleasure. Dr. Sean Knowles, Dr. Novia Carter-Loki joining us on the show. Listen, we have to help each other, do the best that we can to really be in support of each other in this time. Again, sending my love and care and concern to the Lockhart family. You know that Dr. Williams, Susan Williams Lockhart, my Trini expert, friend of the show, friend of Clint's show, beyond the headlines. She's been on my show many times. I consider her a good friend. Her husband, she and I have grown to be such good friends in this pandemic. And I saw us as being lifelong, and we were talking about getting through this and getting over this. And she is in the hospital now, struggling. Well, not struggling. She's doing better, overcoming COVID-19. Her husband also had contracted COVID-19, and this morning we learned of his passing. And so I'm sending love to the children, who are wonderful children, but that we're losing people. And I think we are losing people. The numbers that you see, 308, that was yesterday's number. Today has new numbers. This morning are new numbers. But those numbers are actually people. People that you know. People are fortunate. Most of us will be fine. But when you're talking about, now at 308, That's a lot of people. 35 cases still being investigated. That's a lot of people. What we don't have a lot of is data. But what we did get a lot of today was vaccines. What we don't have a lot today are equipment. How do we make sure that everyone gets the mask or the oxygen levels that they need? How do we ensure that people who have to be seen aren't going home with low oxygen levels, but good enough to leave, but not good enough not to have some physician come to their house? How do we improve this thing? Because what is being done right now, these long-term, medium-term solutions, we need some sort of remedy now. And I believe that it is incumbent on us as a country, but in particular, my leadership, my country, my government, to start asking, knowing pointedly what favors need to be asked, not favors, but donations. And we need to call into account for all of the persons who come in this country and say they love it. And for all of the super rich oligarchs who love it and love to control it, every avenue, ports of entry, etc. Now, rubber to the road. Now we need ventilators. Now we need high oxygen flow. Now we need beds. Now we need a building that can quarantine people. Now we need more than just government borrowing into the depths. We need support. That's what we need. Now we need to call for that. After you didn't get your tax on second homeowners, the government conceded to that, didn't give us a tax anymore. We need that. We need more for equipment in these hospitals so that people who end up to PMH have all that they need as resources, so that physicians who are putting their life on the line, they don't lose their mother, they don't lose their father, sister, brother. Life will come at us fast, and there will be a lot of us. If you get it, Doc was at my mother's bedside, and Laverne, her husband, was there with her. And he was there to make sure my mother was fine. And Doc couldn't be at the bedside of her husband. Tough day. Tough day. Everyone have a good one. Please take care of yourself. Social distance, wear your mask. And let's do what we got to do. Until we see each other again, God's willing. You're listening to The Hit Back with Nahaja Black, Guardian Radio 96.9 FM. See you tomorrow. We're up.
Good evening, Bahamas. You are listening to the Guardian News Network. I'm Taylor Ferguson. Here is your evening report. It is Wednesday, August 11th, 2021. Thank you for tuning in. By the end of the month, government expects to have enough COVID-19 vaccines in country for every Bahamian wishing to be vaccinated. That's according